Bismillahirrahmanirrahim. So this is third in the series of our talks on vaccine preventable diseases for undergraduate medical students. Look at this child over here. He seems to be in agony, flexed posture of the upper arms, retracted neck. Look at his face and eyes. A young infant and actually a newborn over here with a specific posture and not able to open the mouth. You can see the pupillar facial features over here. Another young infant with arching of the neck and retraction. All of them suffering from a disease called tetanus caused by an anaerobic spore-forming gram-positive organism, Clostridium tetani, may cause up to 800,000 deaths worldwide and up to 400 neonatal deaths. Although in large part of the world, the neonatal tetanus has been eliminated. And few years back, there were reports, at least from Punjab, that we have eliminated neonatal tetanus from Punjab. But again, the cases are emerging of neonatal tetanus. The bug enters through the deep penetrating injuries, which are contaminated with soil and other dirty material, crush injuries. Newborn get through their umbilical stump, which when cut by unclean blades or scissors can lead to contamination and entry of Clostridium tetani, chronic suppurative otitis media, and of course, there are certain percentage where cause is not clearly known. A Clostridium is inhabitant of the intestinal tract of many animals. So it is actually excreted with their fecal matter. And if that contaminates the soil, that would be the source of Clostridium tetani once a person sustains an injury. Now, you can read this slide from upside down because generally the wound start at the extremities where after a certain period, the bacteria would release the toxins, the tetanospasmin and the tetanolysin, and they, through the gangliosides on the peripheral nerves, they move retrogradely and reach the spinal cord level where they blocks the inhibitory interneurons, alpha motor neurons, and the excitatory discharges continues, and because of that there is what we call the tetanic spasms. The incubation period is variable, but important to note that shorter the incubation period, severer the disease is. Tetanus, rhizus sardonicus, generalized spasms which are induced by stimuli after 2 weeks of the injury. In neonates, they may have opening the mouth, difficulty in opening the mouth, and feeding difficulties. Sympathetic nervous system, if involved in severe cases, may lead to autonomic dysfunction. And as a matter of fact, in older children and adults, this autonomic dysfunction would perhaps be the major cause of fatality. The disease itself may be categorized as mild, moderate, severe, and very severe, depending upon the degree of involvement of the muscles, involvement of the respiratory muscles, difficulty in feeding, and involvement of the autonomic system. As far as neonatal tetanus is concerned, the biggest risk factor is unclean delivery, unhygienic management of umbilical cord in infant born to unimmunized mother. These are something which is completely preventable. Mother need to be immunized in the pregnancy for tetanus. The baby need to be born in clean environment. Hygienic measures should be taken to cut the umbilical cord so that we can prevent this catastrophic illness in the neonates. Initial few days, the newborn infants may remain normal, but after like 2-3 days, they would have difficulty in sucking because they cannot open the mouth, spasm of the muscles of the face. Progressive difficulty to suck, which may progress for to till day 10, and they may have inconsolable cry because of the hunger and the pain, and then they go on to develop spasms, which would be catastrophic. And this is the time when generally they are brought to hospital. If you look at the umbilical stump closely, there might be remnants of dirt, dung, clotted blood, or serum. Like I said, these spasms, if they continue, may cause spasm of the respiratory muscles, apneas, respiratory difficulties, and even death. Some of the newborns may go on to develop aspiration pneumonias and CNS complications. Prevention is the key. Immunization of the mother during pregnancy with tetanus toxoid, ensuring a clean delivery, sterile cutting of the umbilical cord, and proper cord care. Application of chlorhexidine gel on the umbilical cord after the birth can prevent neonatal tetanus and certain other infection. Once the neonatal tetanus has occurred, the child is admitted with that, may it be a newborn or an adult or an adolescent. Care of the wound is of paramount importance. Thoroughly cleaning the wound with clean water. General nursing care, of course. The specific treatment is with tetanus immunoglobulins to neutralize the circulating toxin. But whatever toxin has attached to the nerve endings would remain there for a certain period of time. Also, you need to eradicate the infection by a 10 days course of penicillin. And if there are spasms, need to be controlled with diazepam or other muscle relaxants or sedatives. If the child is not able to feed, nasogastric feed, and be at lookout for the complications and treat the complications as and when needed. As has been said earlier, neonatal tetanus has got a very high mortality. However, even in the older children, 1 in 10 child with tetanus may succumb to it. Prevention is always the key. Active immunization, the schedule of the primary vaccination we have discussed, and the boosters. Tetanus toxoid to the mother, 5 doses at different times in the pregnancy. We talked about safe delivery, and in established cases, tetanus immunoglobulin or anti-tetanus serum need to be given. This is a table showing what type of treatment would be needed if immunized or an unimmunized child or adult develop wound or an injury, may it be a clean minor wound or other contaminated wounds. Thank you very much. With that, we stop here.